My name is Papadopoulos. I'm a senior dance movement psychotherapist working in East London Foundation Trust, and I'm also managing the Medically Unexplained Symptoms project called SHINE that the Health Foundation funded. As soon as we heard that we had received the funding from the Health Foundation, we immediately started contacting local GPs in Newham. There were 6 or 7 practices that we contacted, and from those practices there were 2 GPs who were particularly interested in the project because they were very sure that this would offer a lot of benefit for their patients. That's the project director, Professor Frank Ruricht, and I, made an appointment to meet with these 2 GPs, and we explained the project to them in a little bit more detail. We realized at this stage that because we wanted at least 140 patients for the project, we would need many more than just their 2 practices from where to refer patients. So they suggested that we come to one of their monthly educational meetings, which we did. We attended the educational meeting and we did a big presentation to probably 8 or 10 GPs and the equivalent amount of practice managers. This was very helpful, and they were very supportive in helping us understand how the 6 or 7 GP practices work. And also at this meeting we were able to iron out some practical difficulties, because for our project we needed a good sized room, we needed a place to store our props, and we also needed to set up a good referral system. As part of the project, we employed a specialty doctor in psychiatry who worked in all of the 7 GP practices. Our GP champions had suggested that he have a clinical space in each of these practices so that he could see patients. Over the period of the project, which was about a year and a half, he saw over 140 patients. And in the sessions with them, he assessed them and also made some recommendations about what they would like to do as a treatment option. He would always give them a handout about medically unexplained symptoms, and then he suggested that they may either join one of the 2 therapeutic groups we were offering. One was called a Strategies for Better Living group, which was a body-oriented psychotherapy group, and the other was a mindfulness stress reduction group. As part of the project, we employed a dance movement psychotherapist to run the body-oriented psychotherapy group and a mindfulness practitioner to run the mindfulness stress reduction group. Each of the groups ran once a week for 8 to 10 weeks, and after the patients attended these groups, they were then reassessed by our specialty doctor in psychiatry. The Strategies for Living group is a new innovative therapeutic approach focusing on the body and using body-oriented therapeutic principles. The theoretical foundations of body-oriented psychotherapy are based on what was traditionally referred to as work with the body and psyche. What we do in body-oriented psychotherapy is we think about the interwoven interconnections between body and psyche, and we develop complex interventions to address them. The central guiding principle of body-oriented psychotherapy for medically unexplained symptoms is that the focus is on the body, and the therapist will not bring up psychological or other factors unless the patient particularly would like to address them. The intervention strategy is designed to address both physical symptoms and emotional difficulty. It works mainly with and through the body and uses sensory awareness techniques, movement exercises, and structured tasks. One significant feature of this approach is that it activates the body's positive capabilities and creativity, and that this helps very much to counterbalance the patient's really negative experiences of their own bodies. It also assists them in managing their pain and their other symptoms. This approach offers flexibility to their patients in response to their desire to engage in body-oriented experiences, and also whether they would like to address psychological dynamics or share their experiences or think about their explanatory models for their own illness. This intervention is conducted in a group setting, taking group therapy principles into account as appropriate. It is a manualized intervention strategy, and the manual is on the website under the training section.